Welcome back to another edition of ADA Broadcast News. I'm Katie Farrell.
And I'm John Holt. We have lots of good information for you as you plan your final days here.
There still are many activities ahead and exciting sessions to attend.
Yeah, you've often heard the expression, we're saving the best for last.
That's a very apt statement when it comes to this meeting. You won't want to miss this year's President's Oral Session.
Yeah, this is the session introduced last year, featuring key abstracts selected from the more than 3,000 submissions. From those submissions, 8 presentations will highlight cutting-edge research and innovative advances in a wide range of basic and clinical science.
We spoke with ADA Medicine and Science President Dr. Elizabeth Sequist and ADA Healthcare and Education President Dr. Marjorie Cypress about the high-profile finish for the scientific sessions.
Katie, we're going to have a really high-profile end to the Sci Sessions this year. We're going to end with the presidential oral sessions. They will consist of 8 abstracts that have been selected to be among the very best that were submitted to the meeting. We'll have things that really range across all of diabetes research, from diabetes prevention to genetics to things having to do with behavioral medicine. But the one I'm really looking forward to is the abstract from Dr. Chowdhury and Stephanie Emil's group in England. They're interested in hypoglycemia unawareness, something that I study myself, and they're using imaging to try and understand how the brain is changed in that condition. So that's the one I'm really looking forward to.
I am so excited about the President's Session because these are the best of the best abstracts. And some of the ones that I'm really interested in is walkability neighborhoods and the association with incidence of diabetes. There's also some interesting information on depressive symptoms and mortality. It's a very exciting program, and I really hope you'll come.
Remember, the President's Oral Session is scheduled for 9:45 Tuesday morning. That's room N134 in the North Building.
Coming up next on ADA Broadcast News, you're going to meet the recipient of this year's Outstanding Scientific Achievement Award.
A1C Now Plus is back. From fingerstick to results in 5 minutes. Demonstrations daily at booth number 2424.
Welcome back to ADA Broadcast News. Some of the ADA's highest scientific honors will be presented Monday morning during the National Scientific and Healthcare Achievement Awards presentation. That session is scheduled for 10:45 on Level 3 of the West Building. Among the awards to be presented is the prestigious Outstanding Scientific Achievement Award. This year it goes to Dr. Joel Elmquist. Dr. Elmquist is the Macklin Family Distinguished Professor in Medical Science. in honor of Dr. Roy A. Brinkley and the Carl H. Westcott Distinguished Chair in Medical Research at the University of Texas Southwestern Medical Center at Dallas. Dr. Elmquist has made outstanding contributions identifying sites in the brain that underlie the coordinated control of food intake and body weight, as well as glucose and carbohydrate metabolism. Dr. Elmquist presents the Outstanding Scientific Achievement Award lecture as a part of the National Scientific and Healthcare Achievement Awards presentation. We asked Dr. Elmquist about his talk.
Thank you, Katie. Katie, I chose this topic because we're very interested in understanding how the brain controls very basic processes. These include regulation of food intake and body weight, which many people would understand. But what our work has found is that there are pathways in the brain that are very key regulators of glucose homeostasis. What we've done through the years is use mouse genetics to tease apart some of these complex circuits. And briefly what we found, and what I'll talk about in my lecture, is that there are pathways in the brain that are really important in regulating basic functions, including insulin sensitivity in the liver. Our studies suggest that defects in these sensing mechanisms may play a key role in some of the defects that are commonly seen in patients with diabetes. It's our hope that our studies will help guide rational approaches to the discovery of novel classes of drugs that may help patients with type 2 diabetes.
Thanks, Dr. Elmquist. Now, take a look at the list of your colleagues who are being honored during the scientific sessions. Monday is a very busy day here at the Scientific Sessions. The joint ADA-ASN Symposium is set for Monday afternoon. The symposium deals with diabetes and advanced chronic kidney disease. You can learn about results from the continuing follow-up to the Diabetes Prevention Program Outcome Study. This was a major multi-center clinical research study aimed at discovering whether modest weight loss through dietary changes and increased physical activity or treatment with metformin could prevent or delay the onset of type 2 diabetes in study participants. The joint ADA-EASD Symposium is scheduled for Monday afternoon. The focus is on insulin secretory defects in diabetes, with an emphasis on new insights into mechanisms and treatment. In 2015, Dr. Samuel DeGogo Jack becomes the President of Medicine and Science, and Dr. David G. Marrero becomes President of Healthcare and Education. Dr. DeGogo Jack is Professor of Medicine and Director of the Division of Endocrinology, Diabetes and Metabolism at the University of Tennessee Health Science Center in Memphis. He's been a volunteer for the American Diabetes Association for more than 20 years. Before the meeting, we spoke with him about his vision and goals for the organization.
Thank you, Katie. The American Diabetes Association is the premier diabetes organization in the world. Our mission is to prevent and cure diabetes and to improve the lives of all persons affected by diabetes. Pursuant to that mission, our vision is to ensure life free of diabetes and its burdens. We want to stop diabetes. Our annual scientific sessions attract delegates and scientists from every inhabited continent on the globe. We want to continue to deliver cutting-edge scientific content that would inform the researchers and practitioners who take care of patients with diabetes. We want to continue to do so in a way that is pertinent. So the ADA will continue to fund scientific research projects, and those projects will be relevant both to the understanding of diabetes and to the better treatment of the clinical patients who present to us. We continue to look for better ways to partner with sister organizations. We continue to advocate for people with diabetes. We continue to fight discriminatory practices. And we continue to lobby for federal government, Congress, and the NIH to continue to increase funding for diabetes research. We believe that only through research can we accomplish our vision for diabetes, which is to cure it and to prevent it and to improve the lives of all persons who currently have the condition.
David Marrero is the J.O. Ritchie Endowed Professor of Medicine and the Director of the Diabetes Translational Research Center at Indiana University School of Medicine. He's worked in diabetes education and research for more than 25 years and has more than 200 publications in lay, as well as professional journals, including Diabetes Care and The Diabetes Educator. We asked Dr. Marrero about how he thinks diabetes education could evolve over the next few years.
Diabetes education is going to have a remarkable move forward for several reasons. First, we have many more ways to treat diabetes than we've ever had before. This is truly the golden age of diabetes. Second, we have a lot of technology that we can apply to diabetes. Mobile applications, web applications, things that allow us to extend our educational abilities far more than we've ever had in the past. Finally, we've gotten away from telling the patients it's your fault, it's your reason, you haven't complied, and we now have a much more holistic, patient-empowered sense of education, looking at the context that people live in and how it affects what they do with their diabetes.
Thanks to Dr. Marrero and Dr. DeGogo Jack. There is still much more ahead on ADA Broadcast News.
Hi, I'm Ron Kahn, past president of the Joslin Diabetes Center, here to introduce you to a new program of the ADA called Pathways to a Cure. In this program, we've identified 5 young investigators who we believe have the potential to be the stars of future research in the area of diabetes. Today, we not only recognize these investigators, but we had a symposium where each of them spoke and gave a talk that gave us the feeling that we have made the right investment for the future of diabetes research. So we hope that you too will support this program of the ADA.
Get ready to experience Invokana, available for over 1 year with more than 700,000 prescriptions to date. Preferred access for more than 100 million prospective patients. Experience Invokana. Visit booth 809 and learn more at invokanahcp.com.
Welcome to the American Diabetes Association's 74th Scientific Sessions. Here, among your colleagues who are sharing their recent work, you'll learn about the latest advancements in research and patient care. And after the conference, we're dedicated to keeping you connected with other professionals and providing you with education and resources that are only available from the American Diabetes Association. We invite you to join us with a professional membership to receive many exclusive benefits, such as the highest impact journals in diabetes research and care, clinical practice recommendations, the most trusted guidelines in clinical diabetes care, exclusive access to the ADA Professional Membership Directory, access to patient resources on proper nutrition and daily diabetes management. You'll also receive invaluable savings like $310 off your next Scientific Sessions meeting registration, equaling or exceeding the full cost of your membership. Free webcast access for Scientific Sessions attendees, discounts on all ADA journals and books, and a subscription to Diabetes Pro Quarterly, the association's insider newsletter, and so much more. Please visit us at the membership booth located in the North Lobby, street level, for information on the special Scientific Sessions offer, or join online at professional.diabetes.org/sessions.
Just days before the scientific sessions, the Centers for Disease Control and Prevention released a statistics report with new data about how diabetes affects the American public.
Dr. Ann Albright is the director of the Division of Diabetes Translation at the CDC. She's also a past president of ADA Healthcare and Education.
Dr. Albright, tell us about some of the key findings in this report.
The new data report from the CDC shows that we have more people with diabetes now. We've gone from about 26 million to 29 million in 3 years. We also now have 86 million people with pre-diabetes, and that's up from 79 million. The increases in diabetes have occurred across all ages and all racial and ethnic groups.
What is likely to be the impact of diabetes in the U.S. in the future?
The impact of this epidemic in the United States is very serious. We have got to fortify our efforts in improving the care for those that have diabetes. We are making improvements in that area. We have been showing improvements in blindness, amputation, kidney failure, but we certainly have a ways to go. We're not where we need to be. The serious factor that we've really got to pay attention to now is we have so many new people developing diabetes that we must work on prevention.
Is there anything that can be done to change that course?
Fortunately, there are things we can do to change the course of this because we are on a trajectory that we cannot sustain. It is vitally important that we really increase our efforts in preventing new cases of diabetes. In fact, 15 to 30% of the people who have pre-diabetes will develop diabetes in 5 years if nothing is done. So it's certainly helping people get into lifestyle change programs that are evidence-based, that we know prevent or delay type 2 diabetes, and it's also participating in changing the environment around us to make it more supportive for those healthy choices. So a lot to do, but we have all the reason to do it.
Dr. Albright, thanks. Now here's a reminder, Monday is the final day the exhibits will be open, so plan to spend some time there. Pharmaceutical companies, equipment manufacturers, publishers, and representatives from various organizations are eager to tell you about their products and services.
And when you're in the exhibit hall, drop by the ADA exhibit. It's booth 1031, and that's where you're going to learn about the latest clinical and patient resources available to you through the ADA.
Of course, you'll want to play Diabetes Pursuit while you're in the exhibit hall. You still have time to play.
Pick up an entry card on your way into the hall and have it stamped as you visit the various exhibits.
Each completed row, column, or diagonal earns you an entry in the daily drawing for an ADA prize pack.
And it's a darn good one. The winner receives a 1-year professional membership, free registration for next year's scientific sessions in Boston, along with a discounted hotel room. Then for good measure, we're going to throw in a copy of Sizzle and Smoke, ADA's newest grilling cookbook.
The final 2 lucky winners will be drawn Monday at the ADA booth. Again, booth 1031 in the exhibit hall.
Time is running out to view the posters before you leave this meeting. They're available only until 2 on Monday afternoon.
Selected investigators will be available to discuss their research from noon until 2 during those guided audio poster tours.
And you still have time to visit the Shop Diabetes store, too. It's the authoritative source for up-to-date resources for both professionals and their patients.
You'll find the new edition of Life with Diabetes, the best-selling and most reliable diabetes curriculum in the U.S.
Other new ADA books include Teens with Diabetes, Therapy for Diabetes Mellitus, the 6th edition, and Diabetes Management in Long-Term Settings.
The store is also a great place to find souvenirs to take home with you. It's located on the ground floor lobby of the North Building, and it's open daily during scientific sessions.
And another great souvenir could be one of these neat lapel pins. The ADA has made these pins available to honor those who've attended the scientific sessions for 5, 10, 15, even 45 years. Still available at the membership booths in the lobbies of the North and South buildings.
Stay with us. There's still more news ahead on ADA Broadcast News.
We're going to hear about how you can contribute ideas for next year's scientific sessions.
A1C Now Plus is back. From fingerstick to results in 5 minutes. Demonstrations daily at booth number 2424.
This meeting is winding down, but would you believe work is well underway for next year's session?
Never too early. Next year's scientific session meeting planning committee is seeking your ideas for making that meeting even better.
Dr. David Alessio chaired the committee this year. We asked him how attendees can help shape next year's program.
Well, very important question, Katie. I mean, every year this meeting depends on a huge volunteer effort. It depends on people contributing their ideas to what makes a good symposium and helping us build the program. It depends on people taking the time to review 50, 60 abstracts and grade them so we can put the best stuff on the program. And then it depends on people who are tabbed to be speakers or to be chair of sessions to take the time, make the effort, and come out and help. It's very rewarding, but again, I always emphasize to people, if you liked the meeting and had a great time here, remember that when you get tabbed to help out, it's worth doing.
Thanks, Dr. D'Alessio. Of course, there is nothing quite like the experience of attending the scientific sessions.
In fact, you better start planning for next year's meeting right away. We're headed for Boston, and what a meeting it's going to be.
Next year, ADA celebrates the 75th anniversary of the scientific sessions, and special activities are being planned to commemorate this important milestone.
And as we mentioned, what a place to celebrate, Boston.
Each of us hope that you've had a great time while here in San Francisco and that this meeting provided a great educational experience.
Yeah, thanks for making ADA Broadcast News a meeting information source while you were here.
Have a great time if you're spending a few extra days here. We'll see you next year in Boston.
ADA Broadcast News has been brought to you in part by Cronus. For nearly 30 years, your trusted source in diabetes antibody test kits. Please visit us at booth 424.
Can you tell?
Can you tell?
Does it look like I'm fighting a disease?
Fighting.
Fighting.
Fighting for my life.
Like my life expectancy is shorter than yours?
There's no outward sign.
But we're battling every day.
Every day.
Every day.
Worrying. Testing.
Treating.
Fighting. Diabetes.
Diabetes has been called a silent epidemic. It's time to call it out for what it is. Help us raise awareness, hope, and vital funding. Help us stop diabetes.